How to manage frustrating BPH symptoms. Are you struggling with bothersome urinary symptoms due to benign prostatic hyperplasia? You're not alone. Benign prostatic hyperplasia, or BPH, is a common condition where the prostate enlarges, pressing on the urethra and causing various urinary issues. Managing these symptoms can be approached in several ways, depending on how severe they are and your overall health. First, let's talk about lifestyle changes. For mild symptoms, many doctors suggest a strategy called watchful waiting. This means monitoring your symptoms without jumping straight into treatment. Simple lifestyle adjustments can make a big difference. For instance, practicing pelvic floor exercises, commonly known as Kegel exercises, can strengthen the muscles that control urination. This may help reduce issues like leaking or dribbling. Managing stress is also key. Activities like exercise, meditation, or yoga can help ease tension, which might worsen urinary symptoms. Additionally, adjusting your fluid intake can be beneficial. Try to reduce the amount of fluid you drink in the evening to cut down on nighttime trips to the bathroom, known as nocturia. It's also wise to avoid bladder irritants such as caffeine, alcohol, and spicy foods. Eating a healthy diet rich in fruits, vegetables, whole grains, nuts, and omega-3 fatty acids from fish like salmon may support your prostate health. If lifestyle changes aren't enough, medications can help. Alpha blockers are a common choice. They work by relaxing the smooth muscles in the prostate and bladder neck, which can improve urine flow and reduce symptoms quickly, often within days. Some examples include tamsulosin, alfuzosin, and doxazosin. However, they can have side effects like dizziness or retrograde ejaculation. Another option is 5-alpha reductase inhibitors, such as finasteride or dutasteride. These medications shrink the prostate by blocking hormones that cause growth. They take longer to work, sometimes up to 6 months, and are generally more effective for larger prostates. Combination therapy, using both alpha blockers and 5-alpha reductase inhibitors, may be recommended if one type of medication isn't enough. For some men, tadalafil, a medication typically used for erectile dysfunction, can also help relieving BPH symptoms. Remember that symptom improvement can take anywhere from a week to several months after starting medications. If medications do not provide sufficient relief, or if symptoms become moderate to severe, there are minimally invasive procedures and surgical options available. Newer treatments like transurethral vaporization or laser therapies are often outpatient procedures with quicker recovery times. Traditional surgery, such as transurethral resection of the prostate, removes excess prostate tissue to relieving obstruction, with recovery typically taking a few days to a week. Ongoing monitoring is essential. Regular follow-ups with your healthcare provider help track symptom progression and medication effectiveness. Tools like the International Prostate Symptom Score can help quantify your symptoms and guide treatment adjustments. Tests may also be done to rule out infections or other conditions. It's important to distinguish BPH symptoms from those that could be caused by prostate cancer, as both can affect urinary function but requiring different management strategies. If you are experiencing urinary symptoms, seeking professional evaluation is crucial for an accurate diagnosis and appropriate treatment. In summary, managing frustrating BPH symptoms involves a mix of lifestyle changes, medications, and possibly procedures, depending on the severity of your symptoms. Always consult with a healthcare professional for personalized advice to help optimize your symptom control and maintain your quality of life.